All right, hello everyone. My name is Darrell Hudson. I'm really happy to join you here virtually and to review our dual degree MSW MPH curriculum with you. I'm very happy to have a great colleague with me from our Field Education, Jenni Harpring, who's going to be sharing with you all the ins and outs about Practicum, which is very important. So we're in a professional school and we want to make sure that you are able to apply what you learn in the classroom in a real world environment. And so again, delighted that you're here with us today. And without further ado, I'll share my screen as we do in these virtual times and walk you through our illustrious MSW MPH dual degree curriculum. So our mission is to educate and prepare future social work and public health leaders in areas of policy, practice, and research. We pride ourselves on pioneering research and applying those results to impact and to really make a broader impact, not just at a local level, but nationally and internationally as well, and to collaborate with organizations to improve access and quality of social services that can potentially address social and economic justice issues. So I think the Brown School is unique, one of the only schools in the country where you have in the same building social work, public health, and social policy professionals. And so we're really committed to advancing education and research in those fields. And it offers a really valuable opportunity for collaboration and cross-training across these fields that are historically deeply connected, but again, really unique in that we have all of this in one building. And as you all know, the current COVID-19 pandemic has really brought to attention the importance of thinking about inequities along socioeconomic status, race, ethnicity, as well as mental health issues. And all these policies and practices that have either worked well or failed or have been inadequate have really become to bear during the COVID-19 pandemic. So a quote from one of our faculty members, Dr. Sanders Thompson, says, if we have a society that has disparities in income and education, we will certainly have disparities in health. And so we oftentimes talk about health in all policies here at the Brown School. So not just looking at a healthcare policy like an Affordable Care Act, but also thinking about how there's connections with transportation and criminal justice and so on and so forth. So our curriculum is designed to be different. So one of the tenets of the Brown School is to be evidence-based. So we want to make sure that our practice is evidence-based. We also want to have a multi-level lens. So spanning from the individual or the micro lens to an intermediate meso lens, all the way to a societal or macro lens. Another hallmark of the Brown School is our transdisciplinary approach. So as we mentioned before, we have our core three disciplines in the building: social policy, public health, and social work. However, we have many more faculty members and who come from different backgrounds. So economics, anthropology, sociology, and a lot of us as faculty members are affiliated with other departments, whether it's in our School of Medicine or other arts and sciences department here at the university. And we're all committed to health and social equity. So that's a theme that you'll see running throughout all our courses and hopefully throughout the rest of your admitted student activities. And so we welcome all different types of careers. So we think about traditional people who are coming directly from college or perhaps out of a service opportunity following college. And then we also have people who are switching careers and thinking about pivoting from their previous work. We have 10 MSW concentrations, and that might sound like a lot, but we really want to make sure that we're able to capture the interest of our students. So you'll see on here, there's the violence and injury prevention, there's social economic development, both in the domestic and international space. We think a lot about older adults and aging societies, again, not just in the United States, but globally as well. We have a concentration in health and mental health, and as well as children, youth, and families. And then switching over to the MPH side of things, our specializations, most of our dual degree students end up choosing the generalist specialization. That makes it probably the most efficient to finish the program in the designated amount of time. But we do have 5 different MPH specializations, including epidemiology and biostatistics, global health, health policy analysis, mental and behavioral health, and urban design. So the typical 3-year program, people in their first year typically take MSW foundation level curriculum courses and practicum. We do see some variance, however. Some students do intersperse with some MPH classes in their first year, but typically the average student will take their MSW foundation level courses that first year. In the second year, students typically start their MPH foundation curriculum practice courses and do their practicum in the summertime. So there's a dual practicum that people complete in the summertime between their second and third year. And then the third year, our dual degree students typically take concentration level courses and specialization level courses in the MPH program, and also complete their final MSW practicum. So totally, you're looking at 85 credit hours from start to finish. There's 33 credits in the MSW program, including 2 practica. And then the MPH program, there's 34 credits, including 1 practicum. So we have 18 credits that are awarded towards both degrees. So again, that gets you to 85 total credit hours. So just taking a look at some of the foundation level MSW coursework, the first year, typically people take human behavior, I should say, research methods with statistical applications, social justice and human diversity. There's some other practice courses, social work practice with individuals, families, and groups, as well as practice with organizations and communities. And again, these are sort of our foundation level courses for MSW students. And then people typically take their foundation practicum in that first year. In the second year, again, people usually start their MPH level coursework. And so our foundation sequence includes epidemiology, biostatistics, health behavior and health promotion, environmental health, and health administration and policy. There's some additional courses that students might take and depending upon how their schedule is laid out, they may start to take practice methods in the social work side. They might also take PI, what we call planning, implementation, evaluating evidence-based programs and interventions. I know that's a mouthful for a course. And then there's a couple of public health seminars that people take. These are 1 credit seminars, and really are a unique opportunity to sit in a truly seminar-based course with just about a dozen other peers, and it's a lot of sort of small group discussion there. And then, of course, again, in that summer between the second and third year, students typically take the MSW MPH practicum. So in the last year, final year, students are usually finishing up their MSW coursework, their practice methods courses. On the MPH side of things, people might be taking a transdisciplinary problem solving course. Again, that's one of the hallmarks of the Brown School is this transdisciplinary approach. And so we think about applying multiple disciplines to different problems. And I'll share with you in just a moment some of the examples for our TPS courses. Students also take their MPH Capstone. I'll explain what that is in just a moment. And then thinking about coursework that fits both programs, there's evaluation and policy. And we also have quite a few skill labs. So skill labs are 1 credit courses that give you a specialized training in a particular area. So those could be quantitative skills like learning how to code in R or SAS, doing data management or data analysis. It could also be a leadership type of course. So as mentioned here, we really want students out of the dual degree program to be thinking about leadership and management. So we recommend that students take skill labs that hone in on those skills. So some examples of recent transdisciplinary problem solving courses that we've had in the recent past. Chronic disease, even before COVID and still during COVID, has been a major issue, and obesity is one of the primary drivers of chronic disease, and not just chronic disease, but also the health inequities that we see in the United States and across the world. We've got global hunger and undernutrition. Another emerging issue is climate change and public health. So we teach a course in that. There's a course on eliminating health disparities. There's a course on youth violence prevention, and so on and so forth. So those are campus-based TPS courses. We also have some field-based TPS courses. So these are courses that are typically during normal times, non-pandemic times, that are offered in a particular country or setting that would be most appropriate for applying some of the skills that you will learn. And so we've got courses that are based in Berlin, courses that are based in Washington, D.C., Costa Rica, and then also Australia. So getting towards the end of the program, we'd be thinking about Capstone. So as I mentioned before, MPH students are required to take a Capstone course and to come up with a Capstone project. So this is a learning experience that demonstrates the synthesis of both the foundational and specialized public health competencies. So this is usually a student-directed Capstone project where you're working directly with a faculty advisor to come up with something that, again, is not quite as big as a thesis, but will allow you to think about ways to synthesize what you've learned in your foundation courses and your specialized public health competencies. An additional requirement is that students in the MPH program also have to sit for the certified in public health exam, and students must earn a passing CPH credential. So this ends up being a sort of not just a program requirement, but it's also something that sets our students apart and makes them more marketable, is that they do have that certification once they finish our program. So now I'll pass things off to Jenni, and she'll talk to you about field education and all the practicum responsibilities that you'll have to take care of during your time in the dual degree program.
Hi, everyone. I'm sorry I lost my screen for just a second. I'm Jenni Harpring. I'm the Assistant Dean of Field Education. I also teach in the general curriculum, and I'm really happy to be here with you today. So field education is part of both the MSW and the MPH program at the Brown School. And we are really unique at the Brown School in that students choose their own practicum experience. So we don't do matching where we cultivate sites and then ask you what you're interested in and then match you. We give you the agency and opportunity to choose your own site. And what that looks like is a couple of months before you're planning to begin your practicum, you will start putting together a cover letter and a resume, cultivate a list of sites you're interested in, and reach out to those sites to learn about their practicum opportunities. We have a team of field faculty who are motivated to support you in your search. We really help you think through what your goals are for the practicum, how you want to spend your time in the community, and what you want to learn from that practicum. There is really close integration with the curriculum. We really try to think about what field experiences are going to reinforce what you're learning in your classes. We also really want you to bring your field experience back into the classroom. So what are the examples? What are the things that you're experiencing in your classroom and in your field site that kind of talk to each other and inform your learning? I'm going to switch the view here for you. Sorry about that. So what will you be doing in your practicum? So you are doing a lot of different things in your practicum, and part of our kind of structure of autonomy is that you really get to think about that with your field instructor. And that's the person in your site that's really responsible for your learning in the field. So students have done everything from create policy briefs to analyze large data sets and make meaning out of those data sets, to delivering direct programs to clients and communities around public health or social issues. You will create at the beginning of your practicum what we call an educational learning agreement. And this is kind of your independent study plan for your practicum experience. Your concentration practicum for your MSW is a really flexible practicum. So your MSW foundation practicum will be completed in St. Louis. Although with COVID, we've been very flexible and students have been completing remote options as well. Your dual practicum and your concentration practicum have much more flexibility built around them. So you can complete those locally, nationally, or if you are in the global health specialization, internationally. And we're really trying to, in that way that we connect your coursework to your practicum and your field experience, trying to build those out in ways that really make a lot of sense. So many of our students that are looking deeply at policy do their practicum in Washington, D.C., or maybe a state capital that they're interested in. And our students that are interested in global health often travel abroad or outside of the United States to complete that practicum. When do you complete your practicum? You can complete your practicum in tandem with your coursework. So you'll have some flexibility and you'll work with one of our field faculty members. And I'm going to show you a schedule now that is, I would say, the most common practicum schedule for dual degree students. So the first year, the MSW Foundation practicum is in year 1 spring. It's 3 credits and 360 hours. A lot of students will kind of pull that spring experience into the summer to provide them with a little bit more flexibility and time to complete that MSW Foundation practicum experience. But typically students are taking their first semester of coursework in their MSW and then starting that field experience in that second semester alongside the rest of their foundation coursework. Then in year 2, in the summer, completing the MSW MPH dual practicum. This is a practicum that meets the learning objectives and competencies of both programs. So we're really looking for those specialized sites that are able to teach both about social work and about public health. Students take this practicum after completing their foundation courses for MPH. So you've completed your foundational MSW, you've completed your foundational MPH courses, and you are ready then for the field work in the MSW and MPH dual practicum. And then in the 3rd year, the majority of students will complete their final 2 credits of practicum concurrently with their year 3 coursework, and are really then looking to how they build off of their first 2 years and weave in those concentration and specialization courses into their field experience. So who will offer support during the practicum search and process? So we will have a 3-hour one-time course called Foundations of Field. It's taught by a field faculty member, and this is really to ground you in the goals of field education and in the field education search process. And then throughout your search and throughout your practicum, there's a team of faculty who are really specialized in field education and thinking about who are our sites, how can students connect to those sites that offer advising. So we have advisor of the day hours throughout the semester. And then when you are in your practicum, you will have a field faculty member that's overseeing your learning in the field. So they will be the person who approves that educational learning agreement I was talking about before. They'll come out and do a site visit and make sure things are progressing well in the site and kind of do an assessment of your learning then. And then at the end of the practicum, in conversation with your field instructor, who's the agency representative, will assign your grade for the practicum. So a little bit about pandemic protocols. This past year, we've had hybrid or remote course format options. So students have been able to take both in-person and remote courses. We really looked at those courses that would benefit most from in-person teaching, our practice courses for those in-person experiences. And then remote courses featured some live content and some recorded based on the syllabus and the professor preference. So I've taught 2 online courses, and we've been doing a lot of kind of synchronous Zoom discussions. It's been amazing to see how we're able to create a community through Zoom, and then do a lot of asynchronous work through TED Talks, videos, case studies to kind of prepare for those discussions. We've had a lot of really great training around this and a lot of support from the school and from each other around how we think about what it means to be teaching in the pandemic. We'll also say that the majority of our practicums were completed remotely. I had a really great conversation with students recently about how much they've learned by completing their practicum from their living room couch, and how surprising that was for them, that they've been able to meet with clients through telehealth. They've been able to facilitate community meetings through Zoom. They've been able to think through what organizational structure looks like when you're not in person, and have really been able to translate this experience of living in this pandemic space to really think about what they're learning and how they can apply that in their future careers. Darrell, is there anything you'd want to add about kind of the pandemic protocols and your experience with that?
No, I think you've covered it well. I've taught in person, and we do have strict adherence to the public health guidance as far as distancing and masking. And so students have, because they're oftentimes limited to taking 2 courses in person, really enjoy the in-class interaction. So the virtual communities are great, but there's oftentimes no substitute for the in-person piece as well. So hopefully, fingers crossed, we'll get vaccines rolled out and we'll be able to meet more in person into the future.
Yes, thank you. So we wanted to talk a little bit about the advising structure at the Brown School. And I think this is one of the hallmarks of us, who we are as a program. You will have an academic advisor, and think about this as your kind of constant conversation partner throughout your years at the Brown School. If you're a dual student, that's most often 3 years. This is a person that will ensure that you register for the classes that you need. We'll do degree audits. We'll make sure that you're on progress with your degree completion. They also really have a lot of information about academic support resources. They can help you think about how to talk to a faculty member if you have a question for a faculty member. They can connect you with multiple resources across the university, and are really a tremendous resource for you in your time at the Brown School. Then you'll have a faculty advisor, and your faculty advisor is assigned to you after you're in the program for a little bit and your interests have really been solidified. They really think about how you are learning in the school. So what's going on for you in the classroom? Where are your growing edges? And how can they connect you with opportunities that will enrich your time at the Brown School? I'm an alum of the Brown School, and I still am in conversation with my faculty advisor when I'm thinking about my career choices. She continues to be a close mentor and conversation partner. And then in field education, you have a set of advisors. You won't be assigned a particular advisor, but a set of advisors that are here to support you as you think about your practicum. And then when you get into your practicum, you will have a field faculty member who's assigned to you that will help you think about challenges in the field, what you're learning in the field, really kind of process that with you if you want to, and provide support in that way. So we want to thank you for spending some time with us today. We are both available for any questions that you have, so feel free to email us. And if we don't have the answers, we'll connect you to the right person. And we look forward to seeing you at the Brown School in the fall. Thank you.